So for those of you that don't know me, my name's Claire Mcgregor. I am the Interim Director of Improvement. There are members of the team that will present, and I'm sure they'll introduce themselves as they go along. I'm the sponsor for the Kaizen event that's going to be discussed in a moment, and Ben is the executive sponsor. Next slide, please. So I thought it would be useful to start with a brief introduction to the team. Most of you would have had interactions with us or worked with members of our team at some point because they support projects across the whole organisation. In September, the team formerly known as the Organisational Recovery Team was renamed the Improvement Team, and this is to reflect the transition from a state of recovery to a more positive method of improvement. The Improvement Team is made up of improvement and transformation specialists who engage with and support teams in the delivery of service improvement and transformation across the Trust. With winter pressures upon us, and as a team, we needed to rapidly support teams to help assist with delivery of elective, non-elective and digital work streams to continue to improve on the strides made during and after the recent COVID-19 peak. So as a team, we anticipated that there would be high demand on the Improvement Directorate to provide this much needed support, and our aim is to provide support at the right time and in a meaningful way. So the Kaizen event that the team will be discussing today was the beginning of work to improve project initiation, progression, reporting and completion of priority programmes across the Trust. And it was a perfect opportunity to use the tools that we promote as a team to reflect on our own performance and responsiveness to our colleagues and find improvement opportunities. So as the lead for this team, I regularly find there's confusion about the different functions within the team, and I thought it might be useful to provide some clarity today to make it easier for colleagues to recognise who in the project teams are doing what, but it's important to note that all functions within the team work together to deliver improvements. So we have improvement leads that provide senior programme oversight for planning, tracking, delivery and risks and issues across the whole programme. And they develop strategic plans with the clinical teams in line with publication of national and local guidance, and they support with programme level agenda setting. The Programme Management Office ensures systems are in place to support, monitor and appraise delivery through robust programme management across the improvement programmes, and they provide oversight of programme milestones, delivery targets and measurable benefits realisation. And they ensure the monitoring of risks and issues, and they provide early escalation if required. And then you've got the Continuous Improvement Team, which were formerly known as the KPO. They coach staff and managers in the use of the improvement tools and techniques, and they use lean methodologies to support operational teams in programme delivery. And they support the delivery of value streams and gather and analyse a range of intelligence to assess areas of focus, support and measure success. I'm going to hand over to the other members of the team now.
Thank you very much for that introduction, Claire. Thank you. Hi, everybody. So my name is Ebenezer. Sorry, I'm using the web-based app today, so you won't be able to see my face at the same time as I'm speaking. So you just have to imagine that I've got a very big smile on my face at the moment. But my name's Ebenezer, but you can call me Eb, and I'm one of the senior continuous improvement specialists. I had the pleasure of being the workshop lead for this Kaizen event, and it was a really, really fun event that we did last week to try and hopefully provide a better service to actually support the organization, especially through winter pressure, and also going forward as we focus on more improvement activities or trying to do things that are a trust priority. So the actual Kaizen event itself was focused on initiation of project support and documentation. Like Claire was saying, we're going to be focusing a lot more as time goes on the other parts of the project support we offer, but this event specifically was going to kickstart talking about initiation of project support and also the documentation. So I'm going to run you through a couple of introductory slides, and I'm going to hand over to the team that's going to talk to you about what they've designed. Excellent. So the aim of the event was to ensure that all project leads requesting support from the Improvement Directorate received prompt and effective responses. There were two main themes. One of them was around reducing the burden of work placed onto those requesting support, and the other one was simplifying the process for all Improvement Directorate team members. And the boundaries for the event itself was from when the project lead requests support from the team to when a named person gets back to that requester and actually starts documenting things for the project. I'll now hand you over to the team.
Thank you, Eb. So, hello everyone. My name is Julia. I'm a continuous improvement specialist, and during the Kaizen event, I was covering the role of a team lead. So what today is going to happen, I'm going to guide you through a little bit of what data were telling us before the Kaizen event and what the data will be telling us after the implementation of the idea. So in this slide, you can see one of the tools that we normally use, which is called Value Stream Map, and it gives us an idea on how the process is running. So as you can see, as Eb has already said, the boundaries were from when somebody was asking for help to when we were providing a documentation to that somebody. And for this process to happen, it was taking up to 10 days. And most of these 10 days were waiting time. The time that we were actually meeting with the customer or producing the documentation was down to 1 hour and 35 minutes. All the clouds that we call Kaizen bursts are at the top of the value stream map. They were all waste, all topic that we could improve on, and implementing the idea of the Kaizen event. So on the next slide, you can see what are the metrics we're telling us. The lead time, so the time that the process was taking was up to 10 days. The value added percentage was 0%, and with value added, I mean everything that add value to what the customer is asking us to provide. The staff satisfaction, as you can see, there's a 42% of staff satisfaction, and that make us understand that most of us were not very happy on how the process was running. And the 63% of defect rate that is related to where we were saving the documentation. The 63% of us were saving it on the wrong place. And the 66% of us were actually not finding the process quite easy to look for documentation on the source of saving. So during the Kaizen event, we put some targets that we aim to achieve on these 4 metrics. On the lead time, we aim to achieve 4 hours, from 10 days to 4 hours to deliver the same support. Customer and staff satisfaction, we aim 100% of quality. And the defect related to the source of saving or where to look for a document, we aim to achieve a 0% of defect rate. So these are the data that we collected prior to the event, and now I'm going to hand over to the rest of the team. Thank you.
Thank you. I'm Leah, and I'm PMO lead and process owner for the workshop. We completed an initial assumption exercise, and this looked at what assumptions we had about the current state process. So some of these were around having no process on prioritisation of the projects, initial incorrect information, the scope of the projects was frequently changing, or customers not having the time to support with programme documentation. There were also a lot of assumptions around not having visibility of the workload that each project team member had, and project changes happening quite frequently throughout the process. So using the initial assumptions, this provided a starting point for us to generate ideas and complete idea forms for each of the assumptions made. So 4 main categories came out here. This included visibility of information, mistake proofing, setup reduction, and direct contact or email process, whether that's through email or phone. And we used the forms to look at ideas for change. What we found was a lot of the ideas that were coming out were around digitalisation, and we wanted to work with what resources we had available through the IT team, which didn't incur any additional programmes needed or any additional financial resource. So everything that we were working with digitally are things that are already in place through our IT team.
Hi, my name's Jackie Zarnocky. I'm one of the improvement leads for the Trust, and I'll actually go through how we actually developed the tool for you. Next slide, please, Eb. So what we wanted to achieve was something quick and easy for the customers to complete, which didn't include paper. We wanted to keep it paperless and to provide an immediate submission to the improvement team. And we also wanted to make sure that the customer got an automated response on receipt of the request, and to be able to ensure that these requests could actually be reviewed by the improvement team and make sure that we could allocate the resources required. And we wanted to make sure that we did this within 4 working hours. Next slide, please, Eb. So what we did, it was basically we wanted to make it as easy as possible for the customer to request support. So we thought about how we actually met with customers at the moment to actually get requests for support, and a lot of that is literally via short 5-minute corridor conversations, just asking for requests from one of our team. So we tried to keep this as quick and easy as possible, and to make sure that we could capture all of the information in one centralised place. And that we could keep it visible and with a full audit trail, so no details actually got lost in translation. We also wanted to be accessible via multimedia, so we thought it could possibly be as a link on our intranet or via Careflow, or also give us the ability to email the link to the customer for completion, or obviously we could actually complete it for ourselves and then send on to the customer for confirmation. We actually put quite a lot of the information in as drop-down boxes to use standard work in this, just to make sure, obviously it was less typing of characters for the customers, more with the pre-populated fields. And once this form is actually electronically submitted, an automated email response is being sent back to the customer, just to let them know that we've received their request. And this way, an email can then be sent directly to one of our team, who will then be able to allocate a member of the team within 4 working and respond to the customer within 4 hours of the request. So there's no more manual processes, and it's all digitalised, and obviously we can find out which resources are available at which time to be able to support. Next slide, please, Ed. So to build this portal, we wanted to make the process as quick and easy as possible for customers to ask for help and assistance for their improvement services. We wanted to ensure they had the ability to request project management support or with improvement activities, including assistance with observations and facilitating improvement events. This portal will capture the minimum information required for the improvement team to be able to review and actually allocate the correct resource, with the full audit trail of requests and no lost data. And we can make sure this is all focused with regards to the support on trust priorities, so whether it be the trust objectives or the winter pressure schemes.
Good afternoon, everyone. My name is Hamza, and I'm one of the continuous improvement specialists within the trust. So as my colleagues discussed, most of the ideas were about how to make this process digitalized, and I will be walking you through this. So it's really simple. It is a transition from waiting for the next corridor conversation to happen, where people can ask for support, to have a platform that actually everyone can access from everywhere and access for the support. So it is a simple transition that we wanted to make between the conversations that are happening in the corridors to push it to a system that we can track our workload. And we're a service provider within the trust, just like IT or HR, and we need to have a kind of platform in place to track all these requests that are coming through. And our team members can get in touch with the person who requests help or requests support, and promptly getting the request through. So the sequence is just like our customer will fill in a request form from the app or a portal. The request could be anything from a project involving patient safety to a simple request that data gathering in a specific place to make decision about something. And the second step is one of the team member will get back to the person who requests the support based on the nature of the support requested and assigned a person who can help with the request. And the final step is the assigned person work with the customer and will log in the project to Microsoft project, MS project, which is provided by the Office 365 as part of the E3 licensing that NHS got from Microsoft. So no additional request, no additional purchase, or no additional app or applications we need. We already have all of these in place under the E3 licensing that NHS has. And this is where Microsoft Project comes to action by visualizing the track of the projects and availability of our resources to assign to different projects. Also, it helps with knowing our demands and the forecasting and allocation of our resources in a more visible way. Next slide, please.
So the high-level process steps are request, review and support. So once the request for support comes through to the portal, the customer would be sent an automatic response, which lets them know that their project has been approved, and they would then receive notification of allocated improvement team support within the 4 working hours. The team would review the form through the portal, and they would be able to determine the correct team member to support the project. And the live dashboard information, which, as Hamza explained, would show allocated support and skill mix, and we would then allocate that to each project and support request. The app would send a notification to the customer, which lets them know who's supporting the project, and the team member would also receive the customer contact details. This would then mean that a member of our team would be able to call the customer to initiate support for that project. And if calls unavailable, they could then send a message notification to them to look at a suitable time to call them back. So the whole process would enable a very quick response within the 4 hours. It would enable a named contact to be given to whoever needs project support. And it would be a much more streamlined and clear process in place. As we explained through the dashboard, it would also enable us to look at resource support and skill mix allocation across the team.
So what are the outcomes that we achieved during the Kaizen event? As you can see, the waste, so the 80% of them has been eliminated with the implemented ideas. And what are the metrics outcome that we achieve? In the next slide, you can see some of the metrics we collected. Abby, if you can go on the next slide, please. We have simulated what would happen during real time, during the real life. As I want to specify, the simulation have been handled as much possible as close to the real process that will happen. But these are the outcome metrics that we collected. So the lead time went down from 10 days to 33 minutes. Customer and staff satisfaction picked up to 100%, both of them, and the defect rate on saving the document on the source would go down to 0%, as Microsoft Project is doing that automatically. These data probably would change in the next 30, 60, and 90 days because there will not be a simulation, but they will be heading around these numbers, these data. Thank you.
Amazing. Thank you. So now the team have designed what the actual improvement idea is going to be. They're going to be spending the next 30 days actually implementing it. So the first big PDSA, the first very big test that we're going to do with the organization is going to be from the 19th of November. So it'll be next month on the 19th of November. That's when the app will be completed. That's when we'll hopefully have MS projects all sorted and we'll be able to actually run a large scale test. As the team was saying, there have been no additional financial financial support or any additional resources actually needed, because the team have been really good at being able to utilize what NHS Digital already giving us. So as part of our Office 365 package, we've actually got access to a lot of good, really, really cool things that we can do, which is quite innovative. And the team have been fantastic at being able to utilize that for this improvement. So one of the things that we wanted just to say is a really big thank you to a lot of people who actually helped us throughout the event. There's a lot of people that we spoke to who gave us feedback about how the app worked, about what they liked about it, what they disliked about it, what was really important to them. And it was really, really important for us to get that customer voice and be sure that whatever we were doing was going to be of benefit to the customer. And the last big thank you I want to give is to the team as well. So to Hamza, Leah, Jackie, and also to Julia. They've been fantastic all the way throughout. They really did rise to the challenge, being able to reduce the amount of time for us to actually start documenting and giving support from 10 days to 30 minutes is fantastic, especially when we're going to be in winter pressure and it's going to be really pressurized at time. Being able to give and offer that support quicker to the organization is going to mean a lot for people who are asking for that support. So I can't say a big enough thank you to the team for really working extremely hard during those 3 days and coming up with something that I think is going to be amazing. So thank you everybody for listening, and that's the end. Any questions or comments?